The Research Family Medicine Residency Program is located in the heart of Kansas City, Missouri. Established in 1974, what is now the research program has a rich tradition of providing the highest quality education in family medicine. Over the past 30 years, more than 350 family medicine physicians have graduated from this prestigious program and now work in a broad variety of areas, including ERs, hospital-only practices, nursing homes, traditional primary care, and clinics heavily weighted in obstetrics and gynecology. No matter what area of family medicine interests you, an education at RMC will provide you with the needed tools to meet your future professional goals. The Research Family Medicine Residency was originally known as the Baptist Medical Center Family Practice Residency Program. In 2002, the BMC program merged with the former Trinity Lutheran Family Practice Residency Program, and in 2006, the name was changed to Research Family Medicine Residency when Research Medical Center became our sponsoring institution. The Research Family Medicine Residency is ACGME approved. The program is unopposed in primary care disciplines and the only residency based out of Research Medical Center. Graduates of the program can be found in 36 states and numerous international locations. A large proportion of alumni practice in rural areas and inner-city locations. The goal of the residency program is to equip graduates with the most well-rounded educational experience.
I chose Research Family Medicine because I thought that the size of the groups was great.
I looked at university programs across the country, big universities, small community programs, and research had everything I wanted all in one.
Going through medical school, as far as family med programs, you always hear about research being one of the top family med programs.
I was looking for a family medicine program that could allow me to work side by side next to internists, also can allow me to explore some of my personal interests.
For me, I was pretty much headed to go OB, and in the middle of my family practice rotation as a student at research, it sort of came together for me that I could do medicine and I could do OB.
Prior to the match, I did a rotation here on the inpatient service and in the clinic, and I got a lot of great experience working with the faculty and the other residents who I felt were very welcoming. I really enjoyed working with the faculty the most. I felt like they gave me an opportunity to ask questions and learn, and that's really what I was looking for in a residency program.
Actually, the exposure that the residents get in this residency to general inpatient medicine and critical care is outstanding, and I think actually exceeds the experience that I've seen in any other residency.
I chose the Research Family Medicine program because of the people that are in this program. All the residents and faculty are very easy to get along with. You're working in very high stress situations, and it makes it very easy to deal with those situations when you're working with people that you like and you enjoy being with.
I was impressed when I rotated with the group as a medical student, the amount of exposure that the residents got to ICU patients.
But I was a medical student here first, and what I got to see were the residents getting together. They knew each other. They were friends and not just co-workers.
And then I met the wonderful people. I just could not believe how they embraced me during the interview process.
I felt that it was a place that I could be comfortable, I could be myself.
I wanted a residency program that felt like home, away from home, and this program has really been that for me.
It was really the relationships between the faculty, the residents, the staff, just the feel of the program. It's a very family-oriented, friendly program that I just felt comfortable in.
The new Goppert Trinity Family Care Clinic is located approximately 2 miles from the hospital on the Brookside campus of Research Medical Center. We moved to our new clinic location in the summer of 2011.
Compared to the old building, this is nicer. It's a nicer environment. Most patients I've talked to really like it.
I can see more patients. My nurses can get people in faster. We can do labs in the same building. I can do it the same day. It just basically streamlines the whole process.
The clinic has 38 patient rooms, including 2 procedure rooms and a treadmill. Residents are assigned to one of 3 clinic teams, which share in the responsibility of providing patient-centered care for patients assigned to that team. In addition, upper-level residents spend a rotation block staffing our walk-in express clinic. We also have a new large conference room area with up-to-date audio-visual capabilities.
We were really excited about getting involved with the medical home because we felt like it was really important for, particularly in a residency program, because it's the wave of the future, not only for patient care, but for education and for getting involved in practice experiences and for the viability of primary care. And then we were really fortunate to be selected as a pilot practice for Blue Cross Blue Shield's project here in town. So we were picked in 2009 to get started with a pilot practice program.
Similar to how our inpatient experience is very broad, our clinic experience is very broad too. So we work with a team of nurses and the same team of residents is there too. So we get a lot of continuity with our team, within our team of the same patients.
In our clinic, we have a very diverse patient population. You see anything from well child checks to adults with multiple medical problems. We get well versed in all types of things, especially diabetes, hypertension, hyperlipidemia, things that we'll see very often in a family practice setting in the future.
The Research Medical Center is one of the region's leading acute care hospitals. This 511-bed facility serves patients from a 150-mile region surrounding Kansas City by providing state-of-the-art medical service and access to advanced technology. It includes a Level 1 trauma center, 29-bed ER, 36-bed intensive care unit, 89-bed telemetry floor, LDRP with neonatal intensive care facilities, advanced palliative care services, and a long-term ventilator management unit. It is the region's first certified stroke center and is a national leader in cardiology services. The residents cover the internal medicine service and become proficient in critical care and management of complicated cases. The Children's Mercy Hospitals and Clinics is the premier healthcare provider for children in Kansas City. It is rated as one of the 8 best children's hospitals in the nation and is noted for its cutting-edge medical research. In order to provide you with comprehensive pediatric training, at least 3 months are spent at the Children's Mercy Hospital. Many residents choose to spend additional months to broaden their experience of pediatrics.
At Children's Mercy, we get to work in their outpatient clinic, their inpatient hospital groups, as well as their emergency room. We get to see a lot of different pediatric cases that we would not see normally, and it prepares us well for practice in the future.
A big plus is that, this is a large tertiary hospital. We have a very busy ER. We get a lot of ICU experience, which can be kind of overwhelming at first.
In research, you are taking care of the more sick, acutely sick patients. You're in the ICU and you may be there for a while, trying to sort everything out, call your consultants, get everyone on the same page, and making sure that every aspect of patient care is taken care of.
But having all the residents here, we always have 2 teams. We have at least 3 residents in-house at any point in time. That seeing people on each floor kind of makes it feel smaller, makes it feel like a homey place to feel comfortable and do your training.
Our faculty consists of 18 board-certified family physicians, 1 intensive care fellowship-trained hospitalist, 2 behavioral psychologists, 2 PharmDs, and a PhD who works as an education specialist. In addition, a vast array of specialists provide residents with a superior, well-rounded educational experience.
The fact that the faculty want to be here, they want to teach. I know for me personally, teaching is my life passion. I spent 12 years in private practice and I love that, but I really, in the last 7 years I've been here as a teacher, I really know that this is what I want to do and what I'm meant to do. And I think that hopefully shows when we're working with the residents, whether it's giving a lecture or discussion in didactics or one-on-one teaching in the clinic or even in our rounds seeing patients on the floors. I think that comes through from all the faculty. And I think we have a variety of gifts, and different faculty are strong in different areas, and I think that really helps for the residents to see that relationship, that as faculty we can refer and discuss things with each other, and we also have different gifts that we share with the residents.
I've become interested in my own clinic practice in geriatrics, and I would say the majority of patients that I see are elderly. And I think that my very special interest in the residency really surround general medicine and in particular the inpatient service, and really love to engage the residents in some of the complex medical problem solving, differential diagnoses that are required there. I tend to get a lot more excited than some of the residents do about the patients that are there, but I hope that my enthusiasm is infectious and that instills in them the same kind of appreciation and same kind of love of the patients that we see there.
Well, I completed a family medicine residency that was strong in obstetrics, and decided to do full scope family medicine with OB, and went back to my hometown in rural Missouri and practiced there for 7 years, doing C-sections, ultrasound, and delivering babies. That was a big part of my practice, a lot of OB and peds. Well, it's a lot of fun to take the skills I've learned in residency and in practice and then integrate that with residency education. I get to still practice myself, and then I can also teach others kind of what I've learned and what I wish I'd known, and some pointers and pearls along the way.
And I think that the faculty see the residents, for the most part, as colleagues in training, junior colleagues that, as they progress towards year 3, really have the role and responsibility and expectations of expertise that a junior faculty level would have.
Since I just graduated the residency program, joining Midwest Women's has allowed me to be in a position where I've been able to supervise the residents in their deliveries and help them as far as furthering their knowledge in obstetrics and gynecologic care. They tend to have a better idea of what residents need and want during their obstetrical experience. So I hope and I think that I've been able to provide that for them.
I hope we're all approachable to the residents, and the residents feel like they can come to us at any time with questions, whether it's questions about their patients, clinical questions, or personal questions or professional questions. What am I going to do? And I love being a part of that relationship. And probably the best part of it is watching residents grow over 3 years to see where they started as first-year residents in July, and then 3 years later watching them graduate and see the tremendous strides they've made.
The specialists that we work with here are great. The majority of them are very approachable and very easy to talk to and like to educate. We have a wide range of specialists that we work with on a daily basis when you're on the inpatient service, and then also when you're in your second and third year and you're doing specific monthly rotations.
I've really enjoyed working with the residents in the ER for the last couple of years. They're a very diverse group. They bring many different talents and strengths and interests to the program, and it's a real joy to work with them.
We generally have one resident at a time that rotates on our service, and that resident will see patients primarily. We try to get the resident to see 1 or 2 cases a day, new cases, new consultations a day, and then that resident will follow those patients throughout the course of their hospital stay. And then we try to meet on a regular basis reviewing topics of nephrology that have to do with those particular patients at the same time.
Our philosophy in working with the residents is that we want them to get out of the rotation what we think will be important for them when they get out into practice on their own. Basically, a lot of this is procedures, sewing in the operating room, learning about surgical problems. When should I refer a patient to a surgeon? When should I maybe get a CAT scan? When should I do a test? Things that will help them in their practice in dealing with a very common problem they see in their practice, which is abdominal pain.
Really almost 30 years now I've had contact with the residents at Goppert, including your director, Dr. Solansky, who was a resident with me for a while. And it's been really rewarding. The residents have been really good, and they've been pretty interested, and we've had a lot of fun.
Well, family medicine, along with other primary care disciplines, is the backbone of medicine. I mean, this is where patients initially go to get their care, get their recommendations, present their problems, and then it's up to the family practice physician to decide, what does my patient need? Is this something that I can deal with on my own, or is this something I need to refer to somebody who has expertise in the area of which my patient has a problem? And that, again, is something we try to teach the residents when they're on our services. When is it time to get a surgical consult?
The goal of our residency program is to equip all residents with a comprehensive education in family medicine, while allowing those who have special interests to deepen their experience and training in those particular areas.
We have an OB track, and that's designed for people that want a more intense OB experience. We recognize when people come to a family medicine residency, there are some that want sort of the core basic curriculum that we can offer and that we should offer all family medicine residents. Then we also have the OB track for those who wanted a more intense experience, and that involves going to the resident's own OB outreach clinic. We have 3 sites around the Kansas City metro area, and the residents there develop their own practice alongside of faculty.
I went on ahead and pursued the OB track, and I want to tell you that has been one of the best decisions I've made outside of coming to this program. I am a single mother. I was a teenage mom, and it's just really a ministry almost to me to be able to work with, girls in the outreach center and moms who may be single parents or just struggling newly in their marriage, and tell them my story and help them through one of the most beautiful processes of life, is bringing a child into the world. And I feel like my living hasn't been in vain, and the training that I have received by going out to the outreach clinics, working one-on-one with an attending, having my own panel of patients, I feel like I am an obstetrician.
I think the beauty of our program is that you can take the OB experience and make it what works for you and for what you want for your training. If you want to do a lot and you want to be a high volume, high risk OB type of person and get more experience, I think you can get that. If you just need to get the basics down to be a good family physician, we can give that to you too, and you can tailor make it to what you want to do for your residency.
Medicine residency program is offering a track in integrative medicine to all of our residents. We are one of the 13 residency programs in the country who is offering this kind of unique opportunity to the residents. This is affiliated with the integrative medicine program at University of Arizona School of Medicine. In fact, I did my fellowship through the same program, and I feel very excited about providing this on-site learning opportunity to our residents.
The residents are exposed to all the nuances of evidence-based medicine and information mastery, i.e. how to approach, analyze, and interpret medical information. What's really unique about our program is the opportunity they get for some hands-on scholarly activity projects. In addition to them actually getting to use their EBM skills, they get to see it in writing, i.e. they get published in our quarterly state journals, and also in the evidence-based practice journals that are put out by FPEN, which is great. It's a great achievement for them. These can be replicated as poster presentations that are put up both at state and national level conferences. In fact, several of our residents have won numerous honors and prizes.
Over the course of 3 years, you can become proficient in a vast array of procedures.
In the operating room, they always get to sew skin. Occasionally, they get to do some other procedures in the OR.
In general, they can do almost any procedure that is available at the time they're here. So the more time they spend with us, the more chances they have for procedures.
First year, I like the way our program is set up because it's giving you all the tools you really need in your box. Second year, you're starting to do more specialized rotations, including pulmonology, including ENT. You're doing more clinic, and so it's actually giving you that next step and that bridge you need to go out on your own when you finish your training. And then third year, you have to pursue your outside interests. So as far as balance, I don't know how they fit it out in 3 years, but it is a power-packed program. It really is.
The night float call system was designed to foster the best possible learning experience while residents are on call. Residents remain alert and well rested, which allows them to provide quality patient care and to follow the resident work hour guidelines set by the ACGME. Medicine Night Float is considered an official rotation for residents in all 3 years, with the third-year resident serving as the in-house supervisor overnight, including supervising ICU admissions. Night Float is a 2-week experience done twice each year. Night Float weeks last from Sunday night to Friday night. Residents also spend 1 week during each block of OB doing OB Night Float.
I think the night float system adds to this program. For one, you get to have your evenings off when you're on service, which is such a big deal because you've checked out your patients. That night float person is consistent throughout that time. They know your patients, and you know that they're going to get good care throughout the night. There's not going to be something that's missed.
I felt that the call system really allowed me to have time at home too. The fact that we have a night float system and we're only on night float for 2 weeks at a time out of the year, you really get to see your family. You get to keep your family a priority along with residency training.
When residents are on OB call, they're in-house, and we have the opportunity to triage our patients as well as the OB group's patients, which opens a door for a lot of experience with triage, but also high volume deliveries.
The level of responsibility on call is great, and I say that because you're here in the hospital, you are taking the calls, you are making the decisions, but you have your backup right beside you. I mean, whether it's in the beginning of the year and your backup really is sitting, 6 inches away from you, or just a telephone call away, and you can always call your attending too. It's not just about checking out to your third years.
An important value of our residency program is the personal development of our residents. Our program is set up to encourage a healthy lifestyle outside of residency training, which supports the development of friendship between residents and staff and scheduling flexibility for maternity and paternity leave. We believe that the most successful, well-rounded family physicians are those who embrace not only their professional life, but also their personal development and time with their families.
We should build on their personhood so that they have both personal and professional growth.
Relationship among the residents were definitely a high point for me in the residency.
Everybody seems to bond well. We all work together like a family. People seem to do everything together.
Social events, gatherings, sports events, dinners, lots of fun, good laughs, and good support system.
This residency program has allowed me to have a well-balanced family life as well. My husband is in this residency program, and so the program's worked with us to make sure that we can balance work and play and also get to see each other. I am a new mom, and it allowed me to have a baby during our 3rd year of residency, and I'm able to manage family and work well.
I think if you interview the faculty here, one of the perks that we have as faculty is to really enjoy watching the residents grow into that role of physician and professional.
When it's all said and done, and when they've left our program, that they say that this was a good experience.
Competitive salaries, Dell laptop computers, smartphones, health and dental insurance, a generous CME allowance, on-site childcare, personally embroidered white coats, relocation allowance, free food every day of the year, reimbursement for any mileage driven to away rotations, and a complimentary membership to the Brookside Health Club are only a few of the benefits our residents enjoy. Be sure to check out our website for the most up-to-date salary scale. Kansas City is a bustling metropolis that crosses the border of both Missouri and Kansas. It offers all of the amenities of a large city, yet still has a small town feel. Famous for its barbecue, jazz, Royals baseball, Chiefs football, and beautiful fountains, it is truly a wonderful place to live and work.
Kansas City's a great place to live. It was a pleasant surprise for me, having grown up in a big city.
So I'm originally from Kansas City. I personally am a sports fan, and so we have 3 major league sports franchises here. If you're not really a sports fan, there's a lot of family things to do around the area.
Our hospitals are located almost directly in the middle of Kansas City, and therefore you can live in any area and get to our hospitals with relative ease.
We hope you will join us in KC at the Research Family Medicine Residency Program.
I would absolutely choose the Research Family Medicine program if I had to do it all over again. The people here are wonderful, the faculty, administrative staff are great. I feel like I get great learning opportunities and experience here, and I can't think of anything else I'd ask for more in a program.
If you're interested in doing a medical student elective or would like to request additional information, call us at 816-276-7650 or visit our website at researchresidency.com.